John, and this is a video on how to do hemoglobin A1C. But before we show you the procedure to do the actual test, we wanted to talk about why you do it and what it is. So hemoglobin A1C is glycosylated hemoglobin, and that's showing the percentage of blood that's coated in sugar over the last 3 months. And for a non-diabetic, normally their A1C is going to be less than 5.7%, which means that over the last 3 months their sugar has been less than 100 milligrams per deciliter. In the pre-diabetic stages, you're going to see an A1C of 5.7 to 6.4%, and what that means is over the last 3 months, their blood sugar has been from 120 to 150 milligrams per deciliter on average. And in the diabetic stage, you're going to see an A1C greater than 6.5%, so for the past 3 months or so, their sugar has been greater than 150 milligrams per deciliter. Once they're being treated, the treatment goal is usually less than 7%, which means over the course of the 3 months, their blood sugar is less than 154 milligrams per deciliter, which is showing that they're usually compliant and their medications are working for them.
I'm teaching you how to take an A1C test. So first of all, we got to gather our supplies, and what we need are gloves, band-aids, alcohol prep pad, some 4x4, some Lecet, A1C now, sample dilution kit, test cartridge, and some hand sanitizer. You want to make sure you have the right patient. Then you want to perform hand hygiene and put on some gloves. Then you can begin with the test. Can I have your cleaner, please? All right, let's start with that one. Then you're going to take the alcohol prep pad and clean the area. Let her air dry for a few seconds. Then you're going to go ahead and poke the patient. Then you want to take a 2x2 and wipe the first drop of blood. You get the sample dilution kit and you want to take the collection device and collect the blood. You're going to put this on top of here and flip it for about 7 times. Once you get done with that, you want to take the test cartridge and insert it in the device. Then you wait until you read the sample letters. You want to open this and put it straight up in the device. Then you wait for about 5 minutes.
All right, so now that we have our blood sugar result, we're going to do a handoff to the provider using the SBAR format. Now, in our scenario, Mr. Lee is going to be our patient. So the situation is Mr. Lee is a type 2 diabetic who's here for increased urination and neuropathy. The background is that he's been a diabetic for 10 years. He's currently taking metformin, 1,000 milligrams daily, but he's not keeping track of his blood sugar in any sort of log. So during our assessment, we noted that he had a fasting blood sugar of 186 milligrams per deciliter. His hemoglobin A1C was 8.5%. He's still having the frequent urination, and he's having a pins and needles feeling in both of his lower legs. That's rated a 6 out of 10. So our recommendation is going to be that his blood sugar is uncontrolled. So we should begin completing a blood sugar log, provide him with dietary and food education materials, and we might need to do some medication education and adjustment depending on what the provider decides.